So one of the plans is first to continue mobilizing resources. Now, for us to extensively cover lung health services, we need equipment, which we are also working with other donors to try and see if they can support that. But then it also requires that the facilities are continuously capacitated so that healthcare workers, as they're doing their routine services, they're able to pick chronic lung conditions.
The environment keeps rapidly changing. New technologies are coming up. Better products are being brought into the market. And sometimes technology and approaches moves faster than the policy. So you have to keep looking at technology is becoming available, but at the human resource side also offset. So evaluation of all those continuously then allows us to make sure that we just don't introduce technologies and innovations and we are not equipping the human side of this work to be done, because that disjointment may not necessarily give us the results that we need.
As we were rolling out digital x-rays and AI as part of the integration agenda, we were noticing that some of the conditions we were picking were lung nodules, and recently realized that some of those lung nodules are actually early lung cancer. So we are currently in consultations with our National Cancer Control Program and the National Cancer Institute, so that then together we can strengthen the referral pathways for those patients.
We need to identify or further the ones which are identified as centers of excellence for lung health. Then we need to equip them further to be able to accommodate all the patients at that particular facility, and the whole county be aware that we are sending all our patients with this condition there, and this is the outcome. As we all do this, we all need to have factored in the resources we require. In terms of the spirometers, we need the peak flows, the drugs we'll need for these conditions like asthma. So we need to see how we are going to work together and have these commodities available to the facility at an affordable maybe price for them, and if it's free, they need to always be there for the patients.
The ministry should also be able to plan for capacity building. And this capacity building should not just be for the healthcare workers that are currently practicing, including those that are in training. We should ensure that by the time they leave the training institutions, they are well equipped, well skilled to handle other chronic lung diseases.
But I would request this project to be scaled to other counties in our region. At the same time, they have a continuous education to healthcare workers and the community, so they can be able to understand about the spirometry.
CHPs tupewe trainings ndo tupate hiyo information. Ukiwa huko mashinani inakuwa rahisi ukielezea shida ya short breathness, inaweza kuwa ni asthma uko nayo, hiyo wheezing inaweza kuwa ni hadi hizo wanasemanga ni allergies. Wakuje waangaliwe zaidi, wajulikane shida ni gani. Okay, Kenya ningetaka kusaidiwa nayo sana sana kama CHP ni kupatiwa kama fare ya kufikia wenye wako mbali, logs and badges.
Kile ambacho ningeomba serikali wasaidie na advertising through television, through radio, through writing and charts on the walls for community, itatusaidia sana.
We are requesting for AIC materials so that we can deliver the messages to the household members, to the community members during health education.
I would like maybe the government or maybe MOH, if they can be able to implement lung health services in the SHA, the National Insurance for Health.
So the ministry with the National TB program needs to procure more spirometer machines and give them to the entire country and have the entire country adopt this approach, because it is working and it's going to be able to help our patients.
We are increasingly seeing a reduction in resource availability, and therefore calling on countries and programs to be innovative.
That this is not just a burden of the Ministry of Health. This is not an issue for national social health insurance systems to cover. If private sector was to throw some of the investment they are making in this country, the problems would be less and we'll be able to cover more people and ensure that we have a healthy nation.
Ningependa kuadvise mtu mwenye ako na hizo symptoms aende kwa hospitali hasa ya serikali na atapata matibabu, sababu saa hii kuna vyombo vimeletwa na serikali katika mashinani, imepewa hizo facility zote zenye zitatuangalia magonjwa yenye tuko naye.
Matibabu iko, mimi mwenyewe nimeshuhudia, nimetibiwa. Bora uzingatie ushauri ambao daktari anakupea.
Ningependa kusema hii nini imeanziwa ni kitu ya maana sana, na ni kitu itasaidia watu wengi, na watu wakubali kukuja kupimwa juu hii kitu ni free.
We are very grateful for this collaboration and partnership. I really want to thank the National TB program and the partners that have ensured that we run this impact project, especially CHAI.
They've been able to support us with spirometers, peak flow meters, pulse oximeters in our hospitals, and they've been able to service our machines, so we don't take that for granted.
So we are really thankful for supporting us, and now the community is able to get the services holistically as a one-stop shop. We are now able to get some of the tests that were only available in Nairobi and outside the country, and we are really getting good outcomes for our patients.
And we're really praying that this program should be scaled up, especially to a lower level facilities, so that screening can be done from the lower level. Level 2s, level 3s, and now all level 4s should be doing lung health assessment.
To the Ministry of Health, to our partners, and to the National TB program, we are very grateful. First, for the knowledge. The knowledge gap has been breached. We now can call PTLD as PTLD, we can call asthma as asthma, which is definitive diagnosis. We can give them the right management, so we are very grateful.
Again, as the county, we are redoing our budgets, and we are able to, and we have actually forecasted to add more commodities within the budget to be able to address chronic lung diseases that are being seen, and we are able now to diagnose.
This is really worked for our patients. We've seen children who would not go to school now consistently. We've seen people who would not sleep now are able to sleep. We've seen people who would not go to work now being able to go to work. We are seeing already revisits reduce at our facility level. So they have really done us well, and I would encourage CHAI and others to continue to fund and support projects like this.
First, I'll say the future is looking bright. For once, we are taking focus away from programs and the silos to the patient. So we are saying we are approaching healthcare from a patient perspective. Now I'm appealing to donors and any other partners who have an opportunity to support this noble project, to scale it up to all 47 counties. Let's rally together to provide support to strengthen the lung health program, so that then we can realize the impact of improving the functional capacity of our lungs, because unless a person is able to breathe, then they cannot work. So it's actually a development agenda.
So I am proud as a person and as an institution, which is CHAI, to have been part of that process. I am proud to see what central coordination mechanism through the Ministry of Health can be able to do. So the pride of knowing that the first contact with the health system of any client is addressed at the very beginning with no delays, and properly classified at the beginning and put on a pathway of care is the greatest pride I have about this program. That is what it has given us.
What is happening in these facilities is not an exception. It is what happens when we build on a strong TB system to do more. Phase 1 was never about numbers. It was about proving that integration could work inside routine care, with existing systems, and with real patients. That proof now exists. The question is no longer whether Kenya can integrate lung health. The question is how quickly This becomes the national standard.